So those joining here and online, this is the Community Development Block Grant Program Year 51 public hearing. We're meeting in the Old Town Hall second floor conference room as well as via Zoom. And today is the 25th of February. It's now 6:04 p.m. We're passing around a sign-up sheet here. I don't know if the caller would like to identify yourself for the record. We'll keep that as part of our minutes for this meeting.
Hi. My name is Mary Ellen McGuire, and I'm the executive director with Bridge House. Hi, how are you?
Thank you for joining, Mary Ellen. So I think you guys are probably very familiar with the program. So I don't want to spend too much time on our program, but we're here to have a public hearing on our Community Development Block Grant Program Year 51. We're just beginning that process. The town receives funds each year from the federal government under the Community Development Block Grant Program, which is administered by HUD. The purpose is to create viable communities, providing decent housing, suitable living environment, expanded economic opportunities, and it's targeted for persons or areas of low to moderate income. We are in the process of updating our consolidated plan, which is a 5-year plan to identify priority housing and community development needs, which will guide the allocation of resources under this program for the next 5 years. Funding has been roughly around $500,000 for the last few years. The trend has been somewhat downward. So we're expecting around $479K hopefully this year. The program does need to meet one of 3 national objectives and be eligible for funding under the program. It's pretty broad in terms of its flexibility for communities to address what they determine to be their priority housing community development needs. But for us, most of our programs will meet category number 1, benefiting persons or areas of low to moderate income. These are eligible census tract block groups within Fairfield that we've identified based on HUD's census information. And we can do a lot of different things. We do allocate monies towards housing, affordable housing activities. So some of the programs that Sonia works with are home ownership and housing rehab programs. We can also do acquisition and clearance and demolition. We have provided funding in the past to make public facilities less or more accessible to folks with disabilities. And made some improvements in terms of drainage and streets and sidewalk improvements, as well as parks. We do have some economic development assistance as well, primarily our micro enterprise program that benefits small businesses, less than 5 employees. And many of you, I mean, in Maryland, you're here because we do provide some funding for public services, which is capped at 15% of our total grant. Our schedule, we're in the middle of doing some topical workshops, but we're doing this first public hearing, and then we have a second one in May. We'll be working to get through the town approval process after we receive your applications on the March 17th, St. Patrick's Day, and then we have to submit it to HUD sometime in late summer. So that's it. Sonia and I are here in the room to answer any questions, but without further ado, I will turn things over to both of you, all 2 of you, if you'd like to provide any comments for our record. So, Mary-Ann, I guess we're going to defer to you first if you'd like to say a few words.
Well, I always feel it's important to show up, Mark.
We appreciate it. We appreciate it. Otherwise, Sonia and I would be just looking at each other. So
I think it was Woody Allen who said that life is about 90% of life is just showing up. And
There you go.
I
There you go.
Yeah.
So you get points for
Um,
just showing up.
but, you know,
I've
I've just been doing this for so long, and I know how you know, important it is to always say thank you, and to let folks know how we're doing and what we're doing. And we have good news this year. We did buy another house to provide a new program for us, to provide a new house for our program. It's in Stratford, 2103 Main Street. We bought it last fall. We're in the process now of having a site survey done, and we're putting together all of our numbers so that we have a clear idea of what it's going to cost to do the rehabilitation. However, we have a good idea of what that's going to be. Our new location will provide a safer environment. We'll be able to, it also has an elevator, which is great. We will be close to everybody. We're just moving to Stratford. All of our members are excited about it. And we have 10 members now that are from Fairfield, and they've all been very pleased to hear we're moving. So that we'll be able to be open nights and weekends and have outdoor activities, et cetera. I think you're familiar with what we do, but we are a psychosocial rehabilitation program for adults with mental illness. We help folks get jobs, keep jobs, stay in their own apartments or get an apartment. We obviously provide a lot of social outlets for our folks. And, you know, our membership is growing. We're getting a lot more younger folks in, I would say in their 20s and 30s, which is very heartening to see. And, you know, we've gone through a lot of changes this year. So some staff has retired, and I have newer staff on board, and it's been quite an interesting year, but it's all going very, very well.
Excellent.
And with your help, we've really, you know, we've really been able to just stay within our budget and make sure that the program needs are met. Thank you.
Thank you very
Thank you,
much.
Mary Ellen.
Yeah. Oops, I can't spell my name right. That's bad. Ernie, would you like to?
Yes, thank you. And my name is Bernie Lynch, and I'm with Mosaic Senior Life in Bridgeport on Park Avenue, which used to be the Jewish home. And I too think it's important to show up and also to say how much we're appreciative of the funding, which is very, very supportive and helpful. I'm reasonably new with Mosaic and reasonably new with adult day programs for older adults. And as I'm reading and learning, there's a wonderful sentence in the existing consolidated plan about the need for targeted outreach and transportation services to reduce isolation. And as a provider there, we are of course interested. We do serve residents of Fairfield who don't have access to a medical model adult day program in the town of Fairfield, to the best of my knowledge. So we're happy to provide these services. The only comment that I have on the consolidated plan is that that sentence that I described refers to physical disabilities. And I was wondering if there would be an opportunity to add cognitive disabilities or impairments, because the need is for people with early memory loss, early onset Alzheimer's, where some type of programming may be helpful in delaying worsening complications. And it keeps people in their homes, avoids institutionalization, helps with the caretakers, the whole range of benefits. But that's really, as I read through the consolidated plan, I didn't see anything else except that that paragraph was qualified by physical, and there may be an opportunity.
I think we can make that change.
To consider cognitive.
Yep, for sure.
Okay, and that's really all
We
I
try
have
to
to
write
say.
these as broadly as possible to give
Right.
ourselves a little bit of flexibility.
Right.
Because the importance of the consolidated plan, as you know, is that we have to relate everything that we do and fund for the next 5 years back to the 5-year plan. So it's important. Obviously, it didn't impede our ability to provide funding in the past, but if we can make that clarification, I think that would be helpful. Not only to recognize the need that already exists, not just at Fairfield, but elsewhere, but just to make sure that we're absolutely clear as to what our intent is going forward. So, thank you.
Thank you.
Worth the trip.
Absolutely.
See, just for that.
Mary Ellen, anything else that you'd like to add? We won't have
No,
to
just that
keep you.
I would like to say to Bernie that I'm sure he's very aware that our population in Connecticut is getting older. And,
Yes.
And we've experienced the same situation at Bridge House. We have members that have been with us since 1986, and they're obviously all getting much older because we're coming up on our 40th year next year, and their needs are changing, and it's sad. I mean, we're having a hard time accommodating a lot of them because now they have mobility issues, and it could really pose a problem in our house. So, we have a population that is young and old and in between, and they have all other issues combined. We have a new member coming in who has been blind since birth, and he's 35, but he's suffering with mental illness. So we don't want to say no to him. But we're going to do our best to accommodate him in our facility. So, we're trying to do our best, as I'm sure Bernie is, just meeting the needs, the complicated needs, because no person is the same. Everybody,
We're all unique in our own ways, right? So.
Yeah, they're all unique. Yeah. So we have to do our best. And so again, I just want to say thanks to Fairfield for always being so gracious and awarding us, this money. I appreciate it.
Well, we have a tiny bit of money, and we try to stretch it as
split
far
it.
as we can. We wish it were more, but that's what we have to work with. So we'll certainly keep doing what we can to make sure that you have the support resources that you need to hopefully meet and provide the services to your members and to the folks at Senior Mosaic. I mean, we definitely support and appreciate all that you do. So thank you.
Both of you.
Thank you.
Bernie, any last words?
No, thank you all. Nice meeting you over the phone, Mary Ellen.
Yes, same here.
Well, with that, we will formally close the public hearing at 6:17 p.m. I think I might be setting some kind of new world record. Well, thank you all. We do appreciate you spending a few minutes with us, Bernie, for coming down.
Coming out.
So we